Hundreds of Rarieda subcounty residents have received free medical care courtesy of the Eliud Owalo Foundation. The residents were offered free tests and treated for various ailments by doctors drawn from the region. The patron of the foundation, who is the Information, Communication and Digital Economy Cabinet Secretary, Eliud Owalo, promised similar medical camps across the Nyanza region in the coming days. Achola Simon with the details.
It was an early Christmas gift for Rarieda residents as they benefited from a free medical camp organized by the Eliud Owalo Foundation. The locals were given free consultancy for various chronic ailments, treated and as well as being referred for specialized treatment. The patron of the foundation, who is also the Cabinet Secretary for Information, Communication and Digital Economy, Eliud Owalo, said the initiative is the first of many that will be carried out in the region by the foundation.
Yes, you see, the approach we are taking as government is to go to the preventive route. Yeah, and one of the critical success factors in preventive medical care is these medical camps, so that we detect diseases early enough. Okay, we should be able to detect these diseases early enough.
That we're having minor surgical procedures, so those who have chronic wounds in the villages, those that are having things that require minor, that basically surgeries that take one day, and within that also we are providing the voluntary male medical circumcisions that is being spearheaded by the National Syndemics Disease Control, formerly called National AIDS Control Council.
Director General for Medical Services, Patrick Amoth, said the government is focused on providing infrastructure that will see the country adopt a more preventive than curative approach.
We have also created another fund called Emergency Chronic Diseases and Critical Care Fund. Many times when you are diagnosed with cancer, the preliminary investigations alone will exhaust your cover. Then before you even start the treatment. So by the time you start the treatment, you have to sell your cow, you have to sell your car. So the government wants to protect you by investing in that ECC fund to ensure that if you are diagnosed with a chronic condition and your cover for social health insurance runs out, then you kick to the Emergency and Chronic Diseases Fund.
Despite growing concerns over the safety of patients' data, as the government rolls out a digitized medical system, Dr. Amotha remained optimistic that legislations in place will ensure the safety of data.
I think we have in place sufficient laws to ensure protection of the data of the individuals under the Office of the Data Commissioner. The other area that we are focusing on is human resources for health. That is perhaps the most important element of any healthcare system. And you know the burden of getting human resources for health globally. The WHO actually estimates that by 2030, we'll have a shortage of more than 10 million healthcare workers.
So if you work hard and seriously, it's going to change. It's going to improve health by 30% in the next 30 years. Just IT alone, without having any doctors, without having any medicine, without having just technology alone, we're going to make diagnosis. So, but sooner or later, although you talk about shortage of doctors, we don't need a lot of doctors in the future. We only need artificial intelligence. Thank you.
Achola Simon, Legends Edition, Kisumu County.